New data coming out of Texas shows tens of thousands of undocumented patients received treatment in hospitals there from November to March. And the health care costs appear to have cost hospitals major bucks. NewsNation's Xavier Walton joins us live from Dallas to break down what's behind these numbers and the controversy it's causing. So, Xavier, is the big issue here that the hospitals likely won't recoup this money? And how reliable is this data?
Markie, good morning. And yes, that is one of many issues here. And this data, pretty reliable, obviously. It's coming from Texas hospitals. Gotta mention, though, this is just preliminary reporting, but this does fall under Governor Greg Abbott's executive order saying hospitals, have to get information, so to speak, from undocumented patients, undocumented immigrants, if you will. Officials from the Texas Health and Human Services Commission testified before state lawmakers. This was Tuesday as they weighed, turning the governor's order into law. And HHSC, which oversees programs like Medicaid, SNAP, and other health and social services, revealed that Texas hospitals treated tens of thousands of undocumented patients, amounting to millions of dollars in healthcare costs just since the data was starting to get taken in. However, hospitals have faced significant logistical challenges, causing delays in reporting. So while accurate, this data still incomplete, and experts caution against, drawing conclusions a little bit too quickly. But HHSC is expected to finalize this data of these hefty healthcare costs by the end of the week. But one thing, Markie, is for sure, they want to take this executive order, some lawmakers, and make this law. That part is getting quite the response and sparking somewhat of a fiery debate.
Yeah, and so tell us more about that, Xavier. What's driving the political battle over reporting immigration status?
Well, some people think it's an invasion of privacy, but then when you put it this way, over the last 20 years, so 2 decades, roughly 180 rural Texas hospitals, have closed, and we're talking about millions of dollars in losses. People want to know when or where all that is coming from. Governor Greg Abbott and lawmakers obviously backing this measure, making the argument that it's 100% necessary because of the financial burden unpaid bills placed on hospitals, in treating undocumented patients, especially in those rural communities. Critics, including the healthcare advocacy groups like Every Texan, say the real issue here is Texas's high uninsured rate, which over 4 million citizens lacking coverage. They argue that targeting undocumented immigrants distracts from the broader systemic issue driving the $3.1 billion annually spent on uninsured care, Markie.
I'll be talking to Texas Congressman Roger Williams in just a little bit, what his game plan looks like and how he wants to rectify the situation. Xavier Walton, thanks so much, live from Texas this morning.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.